I'm John Pena. I'm the CEO and founder of Aufbau Medical Innovations, and we're a biotechnology company that develops therapeutics for blinding eye disease and deadly cancers. And we do that we developed using an enhancing imaging technique to find new targets. If you want to know how to stop a disease, you have to know what it's doing, and you have to target it. And if you can make a drug to hit that target, it helps you so you're not shooting blind. So this started when I was a resident at Cornell. I was examining a 2-year-old child, and this child came in with retinoblastoma, which is a deadly eye cancer. If this cancer gets out of the eye, it can kill the child. This child was perfectly fine afterwards. And so what we found was, when we looked into the eye, you can see the tumor in the upper right-hand corner, but look how it's spreading out into the vitreous. It's the jelly of the eye. All those dots are tumor seeds, and that's how the tumor becomes deadly. But when I look at that, after you make sure the child's okay, it looks to me like it's organized. Something's guiding that tumor. And if it is, what's doing that? So the jelly of your eye, you can see it over on the right. It's completely clear, it's colorless. We take it out surgically. When we remove it, we say it doesn't do anything. The textbooks have a few pages on it. And you're looking through your vitreous right now. And when you see it, we don't see anything. So I said, the system is here. I know it's here because the child's eye told me. And I try to image it on the left. And with this imaging technique, this is a normal cow vitreous. I thought the system was there, and I said it's there. But when I image it, nothing shows up. So either we're wrong or the technology isn't advanced enough. There's a gap in the technology. So we failed, and then about a year later, we figured it out. This is what's in the eye. That's that same tissue. And all of these points, all of these are small nanoparticles that can change genetic information, and it travels from one side to another. It can tell one cell what to do. So this is the system that we were looking for. And as ophthalmologists, we had no clue it was here. And so what we did with this technology is we said, we can use this fundamental imaging technology to look at normal. And if it shows us something that we had no clue was there, what about in disease? Can we see new targets in disease? And so our first opportunity was in glaucoma. So glaucoma is a disease of the eye. You start to lose your vision from the outside in. And the reason we don't notice it, because you don't notice it, you can't see behind you. You also don't notice it when your vision you lose vision from the sides. And so when people come in, they haven't seen an ophthalmologist, their vision can be gone, or it affects about 1% of our population. So about 1 in 100 people in this room over their lifetime has the potential to develop glaucoma. The market for this is about $5.7 billion. The therapeutic market takes about $5 billion, with about $700 million in diagnostics. We can only prevent glaucoma. We can't get your vision back. So that's why if you can develop a drug that can diagnose and treat, or an imaging system to diagnose and a drug to treat, that will be the holy grail for this disease. This demographic it's aging. People are aging. As they age, that 1% becomes a much larger number. So we have to do something to come up with a new drug, new diagnostics. The growth opportunity is twofold. One, the population ages. Two, if you have a new mechanism, we're shooting blind. There are therapies for glaucoma, but again, we have no clue what causes glaucoma. We found a target for this disease, and what we're doing is developing drugs to hit this target to see if we can slow down the progression of this disease. So the team is myself. So I'm an MD PhD out of Cornell and the Rockefeller, and I was an assistant professor at Cornell. But in July, I left a perfectly good job, jumped out of a perfectly good airplane to pursue this, because I believe in it. We have Larry Remmel, who's senior partner. His office is right across the street, and he's in charge of banking and finance. And Larry's very good at developing deals, helping with investment, mergers, and acquisition. Tom Tuschl developed small interfering RNAs. And what Tom's did is he used this and developed Alnylam Pharmaceuticals, which is a publicly traded company, probably about a $10 billion valuation. And also, this is a company, so we need to operate. Bruce Thaw is an excellent person in helping us operate, and he mentors me in how do you get a business from startup to actually making it function. What is our competitive advantage? If you can see what you're going to hit, you can make a drug to target it. Not only that, you can tell if the drug's working quickly. And so that's what we're doing. we want to focus on our initial market, which is ophthalmology, because it's small enough for a small company to grow. Remember, this is a platform technology. So if we can expand into cancer, which we already have work, and we can use non-dilutive funding to grow that, we are. But we're focusing right now on ophthalmology. What are our upcoming milestones? So we're publishing actually next week in a Nature journal. And this one, it tells you that the science is good. It's been vetted and vetted and vetted. We submitted this in 2017, and it's finally coming out. That's how difficult the journal is. We've identified targets in ophthalmology. We're also using it for liquid biopsy for cancer. And so if you can tell someone has cancer from the blood, that's a useful test. Not only that, you can use the data that you get to find new targets, and then you can determine if those targets can be hit by new drugs that you develop. And so that's our company. And so we were founded out of Cornell. We licensed the technology from Cornell. And we have a really great team. We have the IP and the expertise to really push this technology forward. So I'm happy to take any questions if there are. Ouch.
So you found a target for glaucoma.
Yes.
Using your technology. Where do you take that?
Right. That's right. So I think if you know what the target is, you can figure out the drugs. You can reverse engineer.
And that's what your company is.
Exactly. 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 That's exactly right. And you can test to see whether or not it's working. So if instead of doing a 3-year clinical trial, you test it in the lab, it saves you money. And it also can expedite your process. Great.
So great idea. Love what you're trying to accomplish here. How long do you think it would take you to have a commercially viable product?
So that's a good question. So pharmaceuticals, as you know, take a lot longer than, for example, tech. So that's why we're pushing off into, not pushing off, but we're developing a cancer diagnostic, the liquid biopsy base, because it can move faster. Not only that, with a Nature publication, that actually allows you to raise non-dilutive funding. We're decently funded for a startup, so we're able to hit our milestones as we go, because we want to jump our valuation before we take. But also raising non-dilutive funding. I think cancer diagnostics are great because that's something you can push faster, generate a revenue stream, so you have to take less. And then your partners, who are your investors, who are your employees, who are Cornell, they get diluted less. So we're really trying to bring in business development and push in bringing revenue in from other areas. But I agree with your point.
Okay, so that's suddenly very loud. I didn't quite get the time frame from now until a commercially available product. So can you?
My guess is probably be about, it's science one, so it can always go wrong, but our team is good at innovating. Mm-hmm. So we're projecting probably for business development within a year or two, because we can license some of our technology out to other companies, Regeneron. We've had talks with Genentech to bring in business development. Even though you don't have a product, you can help them with some of theirs.
Right. Okay. Got it.
I think you just answered my last question, was going to be, at what point can you use the product as is to help other companies or help in general?
That's exactly right. So I think business development is really important because it lets you jump to the next lily pad. Yep. So that way we can. We don't have to. You probably could raise a lot of money, but then everyone's diluted out that you're working for someone else at that point. So but I agree. I think business development grants are fantastic. Companies publish. At the end of the day, I'm still a professor. I left Cornell, but I still think that way. You want to get this out, publish. That brings in non-dilutive funding that you can jump to the next lily pad, get to your next milestone. So I think it's important as well.
Right, but the ultimate goal is the cure.
Absolutely, absolutely. I think I would separate in two ways. Ophthalmology, I agree. We do stick needles in people's eyes to treat. I seriously doubt someone will let me stick a needle in their eye to diagnose. In cancer, if I can take your blood, that's reasonable. I had my blood drawn last week, not a big deal. So that part, I agree in diagnostics. And typically pharmaceuticals for diagnostics, usually most people turn away, except for that one. And then for therapeutics, for both, it just takes longer. But you want to develop the right drug. You want to kill your projects early. If it's not working, stop it and move on to your next one. Great. Thank you.